So the topic is difference between private practice and public health dentistry. So now we have this subject, public health dentistry. And public health dentistry, what it exactly is, it focuses public health. It is focusing more towards the public health. So the difference between private practice and public health dentistry, in short, I'm going to tell you in this video. And I thought about doing this because there are I'm giving you the complete set of this difference. And this question, it is usually asked as an short answer question, so you'll get a complete answer of it through this video. So the first one is, the individual dental practitioner, he usually deals with one patient at a time, and in public health, the public health professional, he deals with an entire group or population. He considers disease as a mass phenomena. So in private, so the dental practitioner, he is dealing with one patient at a time, and in public health they are dealing with an entire group of population. So it is public health. And the second difference is, the patient comes to the practitioner. In private, now if a patient has a disease or he is having any problem, so that patient is coming to the dentist. And in public health, the public health practitioner, they are going to the patient. So in the way of there are various camps that are organized. So in that way, so the public health practitioner is going to the patient. The next is, the patient, he can do and pay for the services rendered. So in this private practice, the patients, they are paying for their services. And in public health, so the public health professional, he usually has to depend on outside source for funding of the expenses. So over in public health, as it is done in mass population, so over here the prices, it depends upon the funding. So there are these NGOs which funds this public health professionals so that they can conduct various camps. Then the next is, the services which are provided, they are usually immediate and they are visible in private. So the services, if the patient is coming with pain, so the service which is provided to him, so he gets immediate relief from that and it is visible. And in this public health, the public health profession, so it deals with the issues which are focusing on prevention, which may prove beneficial in a long run. So that is fluoridation programs or health education. In public health, moreover, we are focusing towards prevention. So they are dealing with the issues which focuses on prevention, and it may prove beneficial in long run. As you're preventing it, so it is beneficial at any time than the disease. So examples can be, you're doing this fluoridation camps. So there are these fluoridation programs or health education. Then the next difference is, the individual practitioner, he is concerned only about the patient who is suffering from the disease. And in public health, the public health professional, he takes into account not only the person which is suffering from the disease, but also those not suffering from it. So basically, public health is the public health practitioner. So professional, he is seeing the persons who are suffering from the disease, but also the persons who are not suffering. So as we have seen, it is more towards the prevention side. So he makes a community diagnosis to provide community measures for prevention. So in public health, you are more focusing towards the prevention and control. Then the next difference is, the individual practitioner, he is more concerned with the period of pathogenesis. So period of pathogenesis is when the person, he has got the disease. So in private practice, so the dentist, he is concerned about the period of pathogenesis. But in public health, as we know, he is concerned more towards the prevention phase. So for the public health professional, the period of pre-pathogenesis is important. Pre-pathogenesis is when the disease is not occurred in a patient, but there are risk factors which are present. So over here in public health, he is more concerned about the pre-pathogenesis. The next difference is, he is concerned, in private practice, the concern about the environment is very limited. So you're not paying more attention towards environment. But in public health professional, he studies in detail for the environment aspect of the disease. So you are seeing, you are doing the surveys in public health dentistry. So in that, you are seeing the environment too. So the public health professional, he studies in detail the environmental aspect of the disease. Now in private practice, the collection of the information, it is by the history taking and oral examination. But in public health, the collection of information is through analysis of the available health and morbidity records. So over here, they are collecting the information through the records, and over here, it is through the clinical examination and the history taking. Over here there are special investigation which are done, that is your radiography, blood test, biopsy, cytology. So over here in private practice these are the special investigation which can be done, but over here there are this epidemiological surveys which are done as a special investigation. Then the measures for treatment is the treatment plan. It is based on the diagnosis, patient attitude and affordability. So it depends upon the treatment plan, it depends upon the diagnosis and how much the patient can afford. But over here the treatment measures, the action plan is based on the demands, available resources and the priorities. So this is the difference between the treatment measures. So over here the major emphasis is on the curative and the restorative, and over here it is preventive and promotive care. So the services which are provided, so the services provider are the dentist and sometimes with the assistants. Over here it is private practice, so the dentist with assistant or the dentist alone. Over here there is the whole team because they are focusing on the population, so one person cannot do that. So there is this health team professional with paraprofessional and the community volunteers. So in camps there are volunteers who volunteer for this camps. So this is the service providers for a public health dentistry, and this is the difference between these two. Now the private practice and the public health dentistry, by Knudsen it was given like, although the individual practitioner and public health professional, they are both concerned with the patients and the disease, but their approaches are different. It's like basically both are like involving patients and disease, but the approaches, they are different as we have seen in these differences. So Knudsen, he has outlined following differences between the procedure. So he has outlined these differences. So in individual there is examination, and that examination in community is known as surveying. So you are surveying the whole community, and over here you have just examined that patient. Then there is this diagnosis. After examining, you are putting up a diagnosis. Over here there is analysis. After surveying, you do the analysis of it. Then there is treatment plan. After diagnosis, you are giving a treatment plan. Over here there is program planning, as there is mass population. Then the treatment is done. Over here it is known as program operation. Then the payment for the service in individual. Over here the finance, that is the funding from governments or etc. And then evaluation, then you are evaluating the treatment which is done, and it is the appraisal. So this is like the same thing but in a different approach. So it's like the same thing you are doing for the patient, but over here there is individual patient and over here there is mass population. So the approaches, they are different. So according to Knudsen, it is the nomenclature of the activity that varies, while the procedure is basically the same. So basically the procedures are same as you're doing examination, so it is surveying in mass population. So according to Knudsen, it is the nomenclature that changes, but the procedure that you're doing is basically the same. So this is it of this video. Thank you so much.